La 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 la. Ay ay ay, Maria, Maria from Bahia. Everyone wants here. We just say Maria. Ay ay ay, Maria, Maria from Bahia. Everyone wants here. We just say Maria.
أحلى كبسولة طبية هي الطبية.
ألو يا دكتور، مع دكتور سفيان محمد حسين.
هذا البرنامج برعاية سوداني.
بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف المرسلين سيدنا محمد عليه أفضل الصلوات وأتم التسليم. الأهل الأحباب الإخوة والأخوات متابعي الإذاعة الطبية أينما كنتم، السلام عليكم ورحمة الله وبركاته. مشوار جديد وحديث جديد من خلال هذا البرنامج. ألو يا دكتور. بدأنا حلقة الأمس عن مخيم الشفة الأرنبية، ذلك المخيم الذي بدأ بالأمس بمستشفى الأسنان بالخرطوم، وبرعاية كريمة من الجمعية الطبية السودانية، وبمشاركة من الجمعية الطبية الإسلامية الأمريكية. وتحدثنا في حديث الأمس عن أهمية هذا المخيم ودور الجمعية الطبية الإسلامية في مثل هذه الخدمات، وتناولنا أيضا بالحديث العديد من الإنجازات للجمعية الطبية السودانية، وتحدثنا أيضا عن الشفة الأرنبية وأسباب الشفة الأرنبية. وكان هناك وعد منا لكي نتواصل في حديث اليوم عن الشفة الأرنبية وطريقة العلاج، وأيضا ماذا بعد العلاج، وأيضا ما هي الفائدة التي يجنيها المريض من هذه العملية. أنا سعيد إنه يكون معي إخوة من الجمعية الطبية الإسلامية بالولايات المتحدة الأمريكية، وعلى رأس هذا الوفد سعادة البروفيسور مالك. وبروفيسور مالك هو استشاري لجراحة الفك والوجه، واستشاري جراحة التجميل بجامعة كاليفورنيا. وأيضا سوف تكون معنا أيضا من الولايات المتحدة الأمريكية الأخت جيسيكا، وهي مديرة العلاقات العامة لهذا التيم، وهي تعمل في كثير من الأحيان أعمال لها أهميتها في تحضير المرضى وماذا بعد حتى العمليات. مثل حلقة الأمس سوف أتحدث معهم بالإنجليزية والترجمة الفورية إن شاء الله. First of all, Professor Malik, yesterday we start the first show about this camp and about the cleft lips, and also we talk about your mission to the Sudan. And yesterday you were engaged by surgical operation. You didn't able to come, and today you came to us. And really, we don't know how to select the word of thanks for this great work which you are doing and your team. First of all, I, by all means of pleasure, and by all means of greeting, and by all means of the word which I can say and what I cannot say, I welcome by you in Sudan generally and in the medical radio especially.
Thank you very much. Assalamu alaikum wa rahmatullah. First of all, my apologies to your audience that I was not able to make it yesterday. We were busy in surgery. We have a lot to do and the time is very short. So we selected to continue our mission and had to postpone your program. But I'm glad I'm here today. All thanks go to Allah subhanahu wa ta'ala who gave us a chance to come here and serve the people of Sudan. So we're very happy to be here and thank you for inviting us.
بروفيسور مالك بحييكم وبحيي المستمعين، وهو بقول سعيد جدا انه يكون في السودان، وهو كان مفترض انه يكون معانا امبارح ولكن كان انجيج ببعض العمليات الجراحية التي بدأت بالأمس، والآن هو سعيد انه يكون معكم. Jessica, yesterday we gave us 5 minutes and you had promised us to continue today, and today you came to us. Also, heartily welcome by you.
Thank you. It's wonderful to be here and we're grateful and just grateful to share our message.
اوكي، برضو جيسيكا هي بتمثل زي ما قلت انا العلاقات العامة، وهي بدأت معنا 5 دقائق في نهاية حلقة الأمس، واليوم هي حتواصل معنا. Professor Malik, before we start about the cleft lip, we want to know something about FEMA.
Yes.
And your mission.
Yes. Well, FEMA is stands FIMA stands for Federation of Islamic Medical Associations. We have several countries where there are Muslim doctors.
Yes.
They have formed their own IMA, which is the Islamic Medical
Yes.
Association. Like in Sudan, we have SEMA. In United States, we have IMANA. In Pakistan, we have PIMA. So on and so forth. So we have several organizations all over the world.
Branches to the main.
Yes.
Yeah.
But in
Pakistan, in Sudan,
in everywhere, in a lot of countries,
Yeah.
including a lot of African countries and Asian countries. Now, in 1981, some of the organizations from the IMAs of the world, they got together in Florida, America. And they came up with the idea that we should have a umbrella organization, which can connect all the IMAs of the world. So this is how FEMA came into existence. So it's been there since 1981. Now, IMANA is much older than that. IMANA was formed in 1967.
In America?
In America.
Yes.
Now, currently, the membership of FEMA is that we have 30 country members of FEMA, and we have about 12 non-country members, which are NGOs that do some of the work, medically related work.
But working with you?
Yes, working with us together.
Yeah. Okay.
So our job is to connect all the IMAs, and this is how we connected IMANA with SEMA. This is how we connected doctors worldwide of Turkey, Pakistan, PIMA, and all those organizations. We work together, we connect them, and we have certain projects that we all do the same kind of work. And since we are all doctors and medically related people, we do whatever we can do to respond to disasters, God forbid, earthquakes and tsunami, And peacetime, what we do is we do these different camps. Some of the biggest project that FEMA has is the Save Vision. The Save Vision has several doctors, about almost like 100 ophthalmologists from all over the world. They have done work in so many countries, including Africa and including Sudan also. They have completed almost like 90,000 cataract operations so far. In Sudan,
in the last year, I think.
In the last year, yeah, this is the figure until now. In Sudan, they have done quite a lot of work in Jenin. They have set up a hospital, and that hospital is still working. And the teams are coming. They not only come and do the work, but they also train the local doctors. So when they are gone, the work continues. So this is one project. Then second project we started was FEMA SaveSmile. This project came up, the idea came in 2008. The FEMA had a EXCO meeting in Jeddah, and the past president of SEMA, Professor Mamoun Homaida, was one of the committee members. And while we were walking on the streets of Jeddah, he asked me, he says, "You are a plastic surgeon. Is it possible to do something in Sudan? We have a lot of cleft lips and cleft palates. And is it possible for you to do something?" And I said, well, definitely. I went back to States and I talked to some of my friends, and we formed a very small team. So 4 of us came here in March of 2010. That was our first camp. We did it in the Academy Hospital.
That means you came here before?
Yes, this is our 4th year. This is our 4th mission.
That means you are familiar with Sudanese patients.
Absolutely, absolutely. We know them very well now, yes. Yes. As a matter of fact, I have been here 4 times. They should give me passport.
No, not next time. Now I can give you the passport, Sudanese passport.
Right.
Okay, تحدث الدكتور بروفيسور مالك عن الجمعية الطبية الإسلامية، وهي منتشرة في كل دول العالم ولها أكثر من 30 فرع في 30 دولة، بجانب هناك بعض الجمعيات الطوعية اللي بتعمل مشاركة اليوم. وتحدث على انه هم بيقدموا خدمات عظيمة، هم بيقدموا خدمات طبية، بيقدموا مع مجموعة من الأطباء، حتى في بعض الأماكن أنشأوا وحدات طبية ووحدات علاجية. وهو كان في المملكة العربية السعودية والتقى بسعادة البروفيسور مامون حميدة الرئيس الأسبق للجمعية الطبية الإسلامية السودانية ووزير الصحة الآن بولاية الخرطوم، وتعرف عليه البروفيسور في جدة وسألوا عن إمكانية الشيء اللي ممكن يقدموه في السودان، وتحدث له عن الشفة الأرنبية. وفعلا جاء في العام 2010 والآن هو جاء وقال لكم لو جاكم المرة الجاية تدوني السودانيز باسبورت الجواز السوداني، ونحن قلنا لنا نديك الجواز السوداني من الآن. أنا حأمشي مع أبو بروفيسور مالك عشان نشوف الشفة الأرنبية دي شنو وبتتعالج كيف، لكن قبل ذلك أمشي للأخت جيسيكا، وجيسيكا هي مسؤولة العلاقات العامة. جيسيكا, you are responsible about the public relationship and media. Can you tell us about your role in this team?
My role for the SaveSmile mission is to create awareness so people understand what we're doing, as well as get support for our team. It's been a blessing because our team is growing. Like Dr. Malik had said, it's been 4 years, and when he started, there was only 4 people.
Yeah.
He started, he had a vision, and he said, you know, I really want to help and do something. And honestly, we would not be here if he didn't have the courage to move forward and ask people to help and to inspire other people to help. So thankfully 4 other people joined him 4 years ago, and now we're here on our 4th annual cleft lip mission, and now we have over 30 volunteers with us.
Very nice.
So it's grown tremendously, and I've been with IMANA for 18 months, so almost 2 years. This
United
is my second.
States.
Yeah, this is my second mission with them. So this is my second year, and my role is to share the story, to share the story of what our volunteers are doing, and the patients and how we're impacting their lives, and to get support in the United States, you know, to get financial support for our donors, and also
To the association.
Pardon me?
For association.
Yes.
for the association.
So we want to make sure that we get enough support to continue, and we want this mission to grow. We want to be able to do more surgeries every year and to be able to get more volunteers, and just really watch this mission grow as it is naturally. But I would like to support it as much as possible and for it to grow.
Yeah, it is a great
in
effort.
Sudan and other countries as well. You know, we want to also, you know, make it go to other countries and help other people who have cleft lips. So that is my role within the SaveSmile mission for IMANA Medical Relief.
I think it is a very great role,
Yeah.
and it is a very important role.
Absolutely.
And without her role, Professor Malik,
Yes.
I think you can't able to do. You will not
That-
be
that-
able
that's,
to do.
that's very correct. You know, for example, when we come, we concentrate with our work. We are busy in doing surgeries.
Yes.
But then she connects people. She connects with the human beings. She connects with the families. She interviews them. She talks to them. She has filmed some stories, and she's still working on it. These are the things that, you know, we cannot do. We don't have time. And she has a, mashallah, very good ability
Yes.
to attract these conversations and make very good stories, you know, that already exist. And she just has to bring it out.
Very nice.
And she does
very
it very
nice,
well,
very,
mashallah.
very nice. وتحدثت وأضاف البروفيسور على إنه يعني الأخت جيسيكا بتأدي عمل عظيم وعمل كبير. يقف على رأس هذا العمل. هي بتمشي وتبحث عن المتبرعين لدعم هذه الجمعية، وهذا الدعم اللي من أجله هم الآن في السودان، وهذا الدعم اللي من أجله كل الأعمال الجليلة دي بتقوم. وحقيقة ده أنا بعتقد إنه هو أعظم دور، وزي ما قلت لها أنت الدور اللي بتقومي به لولاو الجمعية ما كانت تقدر تؤدي هذه الخدمات. Okay, Jessica, let me to ask you one question. What about your relationship with the patient, direct relationship with the patient?
Well, today it's been wonderful. I was actually visiting a patient's home.
Yeah.
This patient lives in Kosti. His name is Bella
Bella.
Abu Ghazi. And he's 10 years old, and I was with his family all day since the morning. And went to his home. Graciously, they opened the doors for me and allowed me to have a camera on their face all day and film their mother, his father, all of his cousins came, the neighbors
You
came.
enjoy with them.
Yeah, and to see
You
how
enjoyed with them.
see his daily life prior to us coming. And they share the pain that their family's going through as well. You know, this boy has been made fun of in school. Some of the children drop out of school, so some of the children are even, you know, in tears, expressing the fact that they don't fit in anywhere. You know, they have to have their face covered anytime they leave. Some of the women shared that they couldn't get married because of this.
Cleft lips.
Yes. So it really has a great impact on their life since they were born. And it's such a small surgery for us. You know, it takes only 30 minutes. And it's a $200 surgery, and we literally change a person's life forever. Women come back and say, now I'm married. You know, 1 year later they come back, and now they have children, and they have an opportunity to live a life, you know, in the best way that they can, and to have the opportunities that every human being should have: an education, a job, a family. And
Generation
so,
of smiles.
smiles. We're
Yeah,
bringing
smile
smiles to
generation.
Sudan.
اوكي جيسيكا هي بتتحدث على انه عندها دور عظيم، وبدت لنا انه اليوم مشت لبلة ابو غازي، اسره سودانيه، وتحدثت معاهم وعرفت انه يعني كانوا على درجه من الالم، وحتى الدموع يعني نزلت وانهمرت. وتحدثت على انه يعني الواحد لما يكون بالشفه الارنبيه ما ممكن يغطي وشه لانه بخاف من الوصمه الاجتماعيه. وقالت لكن بعد العمليه التي لا تستغرق اكثر من 30 دقيقه بتكون هناك بسمه مدى الحياة، وهناك من تزوج وهناك من اتفتح باب الحياة له من أول جديد. And let me to go to Professor Malik, and we want to talk about the operation itself. And before to go to the operation, the surgical operation, it is the only solution to treat the cleft lip?
Unfortunately, yes. This is a birth defect where the formation of the face gets interrupted, and the mouth has like a circular muscle, and with that circular muscle, you know, we talk, we speak, we whistle,
we smile,
yeah. Basically, yes,
and
absolutely.
This is an important point.
Yes, exactly.
Yeah.
And what happens is that the muscle gets interrupted either on one side or on both sides. So what happens is then the floor of the nose gets connected with the mouth. So depending on the severity of the deformity, the cleft can be only on one side or can be on both sides. So when it's on both sides, then it looks even worse, you know, because breathing and eating has the same passage. So the children tend to vomit, you know, everything comes out through the nose. So this is a deformity that, you know, is unfortunate. We don't know why exactly it happens, whether it's some substance in the environment, or we do know that it runs in the family. If there is a parent with a cleft lip, there's a possibility that the children may have a cleft lip and a palate also. It's a genetic. But why it happens, we really clearly don't know. The incidence is
there is no specific reason.
No specific reason. And in Sudan, it seems like it's more common because we see this more, although every other country has the same kind of incidence. But here the problem is that there's not too many places where they can go and get it repaired. There are not enough doctors here, first of all, and if there are, either they're not trained or they are not doing enough of these surgeries. So people have to wait a lot, many years, I understand. And also, if they do get these things done, it's very expensive, and they cannot afford it. So that's why we have seen the oldest patient that I operated on last year was 48-year-old. And I heard a story the other day that somebody died at the age of 75 with a full cleft. So they never got a chance in their life. So we are here to do whatever we can. You know, we think that this is a chance for them to avail, to get the opportunity. And not only we treat patients, we operate on patients, but we encourage the local doctors to come and spend time with us and get training from us.
This is a very important point.
Yes, absolutely.
If you will come to Sudan and to treat 100 or 200 patients without doctors getting training, I think this is not the aim.
Absolutely. So we encourage continuity. We even leave our equipment sometimes. We have left them with a lot of teaching material, and we have told them this is our email. Anytime you have a question, we have students coming and you know, scrubbing us in the operating room. We give them one-to-one instructions, and we encourage them to continue this work when we are gone. So the work continues during the year.
اوكي طيب بروفيسور مالك تحدث على انه السبب تحديدا ما معروف للشفة الأرنبية، وتحدث انه ممكن العامل الوراثي بيلعب دور كبير جدا، وتحدث على انه هي حسرة انه الانسان يكون عايش بها. وقال هو تفاجأ انه في السودان في ناس عمرهم بيكون 70 75 سنة بيتوفوا من غير انه يتعالجوا، وعز الشيء ده قال لغلة الأطباء اللي بيشتغلوا العملية دي. وبرضه تحدث انه قال هو يتأسف انه في حالات كثيرة للشفة الأرنبية في السودان، وقال انه هن بيجوا وبعالجوا الناس، لكن المهمة الأساسية التريننج، التدريب، انه يدربوا ناس عشان يشتغلوا هذا الشغل. بروفيسور مالك، can we consider malnutrition during pregnancy representing a main cause?
Not that we know of. We are not sure if that's the reason, and I don't think that's the reason. Like I said, we can't pinpoint, where the problem is. Genetics is the only thing that we can be sure. That there's a possibility of transmitting this to the generation. But I think maybe during pregnancy, some
folic acid,
something in the atmosphere, or some medication that people take, maybe some food or anything can interrupt the process,
or some poisoning,
and something in the medicine, or in the food, or in the water. We're not sure.
Or in the environment.
It's the environment. Yes, exactly. So we don't really know how to prevent it. All we know is once it happens, we just have to treat it. We can't just let it go untreated.
Okay, having folic acid during pregnancy, it can protect this cleft lip. There is any relationship between having folic acid and this disease?
Not that we know of. Not that.
No
we know
evidence.
of. No.
So far.
There's no proof.
No
proof. Yes.
اوكي. هو سألته أنا عن التغذية ودور التغذية، فهو تحدث عن نقطة مهمة. قال استخدام العقاقير الطبية دون استشارة طبية، وقال تعرض الست الحامل لبعض الغازات السامة أو لبعض المأكولات، هو بيقصد كان المأكولات الغير طبيعية، المأكولات الصناعية التي تحتوي على مواد كيميائية ممكن تكون هي سبب. لكن قال بصورة عامة إنه السبب الأساسي هو اللي معروف لغاية الآن هو العامل الوراثي. لو في أب عنده المشكلة دي ممكن الأولاد أو الأجيال القادمة تكون بتعاني من نفس المشكلة. Jessica, you talked about volunteers and donation. How you succeed in this mission? To some extent, how you succeed in your mission?
Well, there's many levels and different approaches that we take, but I think the number one way why we're growing is because of word of mouth. Word of mouth, and because of the impact that we're making. Every volunteer goes back home and they talk to their colleagues and they share stories and they share photos. Our physicians do lectures. We have dinners. IMANA hosts several meetings several times a year in different cities. And we share our work. We talk about SaveSmile. Our chair, Dr. Maher, he does an excellent job recruiting volunteers. He inspires people to want to make a difference too. He shares with people how, 30 minutes can change a person's life. That's sort of, we tell people it doesn't take that long. And if they can volunteer their time, they make such a big influence. So it's really spreading. I think everyone goes back and they share the stories, they share the message. Of course, we have photos on our website as well as some videos that we've been sharing on Facebook and other, social media, our website. Sharing the stories, and people volunteer on our website, so people are seeing it from different states, and they're sharing it. So they're excited. They're excited to be a part of something that is really making a difference. And that's what we say. IMANA Medical Relief is making a difference around the world. We're truly making a difference. So if they want to volunteer, we're a great opportunity to, volunteer for. Medical students come. They get to learn from some of the best physicians. We have, many, many medical students that are excited because they're getting hands-on experience. We also have a lawyer. We have people from many, many different specialties. So
not only medical.
No, not all medical. Obviously.
Lawyers and students and public relationship officers. So many professionals, as you said.
Honestly, we want anyone, whatever their specialty is, to come and to be a part of it. So, my specialty is photography and video, so that's where I was able to fit in. So there's a place for everyone. There's a place for everyone to volunteer and to be a part of it. So it's very simple. People can go on our website and volunteer. And like Dr. Malik had said, even the physicians here can come and learn. Transfer of knowledge is very important to us. We teach. Not only are we giving surgeries, we're also teaching while we're doing it. He's teaching the practices. He's talking about the muscles. He's talking about the procedure. So the students can actually learn because, unfortunately, we're only here once a year. There's so much need and there's so many patients. We have patients waiting, lines and lines of patients who are waiting for days, trying to get in. Yesterday when I left, there was literally patients trying to push into the door, handing you their children and saying, please, please help my baby. Please. So transfer of knowledge is very, very important to us, and we want to be able to train and to educate and to teach.
It is a great effort. Really, it is a great effort.
Yeah. Well, I just wanted to add a couple of things that the surgery actually cost almost like $200 per patient. This is our cost for the supplies, the medications, the sutures, and everything. The team that comes here to Sudan, these are all doctors busy in their private practices, anesthesiologists, plastic surgeons, pediatricians, emergency room doctors. They take time out from their profession. They pay their own airfare to come here. And then the rest of
not from the association.
Yeah, not from the association.
From their own
from their own pockets. And when we come here, the Sudanese Islamic Medical Association, SIMA, hosts us while we are here. So when we present these programs in America, we try to do fundraising. For example, in my mosque where I live, it's Islamic Society of Central Jersey.
In California?
I live in New Jersey now.
New Jersey.
Yes, in Missouri I trained actually.
Yes.
But currently I live in New Jersey, and I mentioned this in the mosque. I made like an announcement that I'm going to do this mission, and I'm going to help our Muslim brothers and sisters in Sudan. And they were very excited. They were very happy about it, and they donated $5,000 towards this mission. So this is the kind of things that we do in the United States, and we have a very positive response because it, like I said, it is expensive. It is getting more expensive, with the time to take care of this. But inshallah, we will continue this mission as long as we can.
inshallah. جيسيكا تحدثت على انه هي بتعمل مجهود عبر الانترنت وعبر الفيسبوك وعبر معظم الميديا المتاحة. هي بتكون في تواصل والمتبرعين بيستجيبوا. واهم نقطة اضافها البروفيسور مالك انه يعني حتى الاطباء بيجوا من جيبهم الخاص. يعني الجمعية ما بتدفع لهم حتى التيكت، حتى التذكرة بتاعت الطيارة بيدفعوها من جيبهم الخاص. وقال لما تكون في حاجة زي دي يعني في جهات كثيرة بتدعم. وهو قال هو بيقيم في نيو جيرسي، وقال في المسجد اللي في نيو جيرسي لما جاي السودان وقف وقالوا لنا يا جماعه انا ماشي السودان عشان نشتغل شغل كده لاهلنا مسلمين في السودان. فقال في وقفه واحده طلع $5,000 امريكي في وقفه واحده. وانا بعتقد هذا هو المفهوم الحقيقي للحديث الشريف. المسلم للمسلم كالبنيان يشد بعضه البعض، إذا اشتكى منه عضو تداعى له سائر الجسد بالسهر والحمى. as our prophet said, Muslim to Muslim like a body, if he develop a pain in any organ, all the organs will generating this pain.
Yes.
This Muslim, the relationship between Muslim to Muslim like this. Yes. So that is why people in New Jersey, they are paid this $5,000 to share people in Sudan, to share people in Pakistan, to share people in Afghanistan, to share people in Iran, to share people everywhere in South America.
That's true. Very true.
Yeah. Okay. Professor Malik, actually, what you are doing in this lip to retain back the smile to the face, actually what you are doing. انا سألته انه عشان يعيد البسمة دي بيعمل شنو، العملية شنو، الان حيوصف لنا العملية.
Well, basically, remember I told you about the round muscle, the circular muscle. You know, it's interrupted. So what we do is we bring that muscle back together, so it's back to a circle again. So by creating that circle, then all the skin and everything comes together, so they get stitched up, but it has to be done in a very proper fashion. It has to look the way the normal lip
no difference
looks. Should be no difference except for the scar, but there should be no difference. The person should be able to smile normally, should be able to whistle, should be able to eat properly and not have the food coming out. So this is our goal, and alhamdulillah, techniques have gotten much better, and we are doing a better and better job as the time goes. So people are very happy, they get very excited. As a matter of fact, some of the patients don't recognize their children after we done surgery. This happened.
It's not my baby.
Yeah.
Where is my baby?
4 years ago it happened.
Looking for her baby.
Yes. 4 years ago, a mother refused to recognize her baby. We had to get her husband, and he recognizes, yeah, this is our baby. But she was so appreciative. So these are the things that make her more excited. You know, we want to do this as much as we can.
And this create happiness for you.
Absolutely.
You will feel happy.
It sure does. It sure does. Yes.
تحدث البروفيسور بانه كل اللي حصل انه بيكون في تهتك في جزء معين من عضلات الشفه، فهو الشيء اللي بيعمله بيعيد هذه العضلات لمكانها الطبيعي عشان يسمح لهذا الطفل انه يتحدث كويس، يبتسم كويس، ياكل كويس، حتى اللعاب السلايفه ما تكون طوالي، هي سائله ورننج من فمه. فقال بالامس هو اجرى عمليه، ولما جاي يسلم الطفل لامه، امه قالت لي ده ما ولدي، شوف لي ولدي وين جيبه لي، لغايه ما نادوا ابوه ويتعرف على الطفل. و Jessica and Professor Malik, so many people are waiting us in the telephone. Let us go to those people to share us this show and to answer their question. الإخوة والأخوات متابعي هذا البرنامج، الآن نحن مستعدين لاستفساراتكم ومستعدين للحديث اللي عايزين تقولوه، فنحن سعيدين بمشاركاتكم. وعلى الأرقام 0155 72 49 0183 22 99 59. ونحن بنسعد بأول مشاركة وأول مكالمة. Definitely they are going to ask by Arabic, but don't worry, Professor Malik, Jessica, I'm going to translate you their questions. Just I want you to listen
to the question.
Yeah, the question. السلام عليكم. اتفضل. مرحبا بك.
الو.
اتفضل معاك، احنا نتكلم.
بس كنت البرنامج ده انا فجأة كده صحيت ويعني I want to know the lecture only.
اتفضل، معانا منو؟
احمد بهبكر.
طيب يا احمد بابكر، نحن معانا الليله اخواننا مسلمين من امريكا جو هنا عشان يعالجوا الشفه الارنبيه.
ايوه.
عندك سؤال؟
والله never, but I want to take some information about this case only.
He asking you, Professor Malik, you want to know something about the cleft lip. What is the cleft lip? What we mean by cleft lip?
As we mentioned earlier, this is a defect in the development during the creation of fetus in mother's womb. The face is actually has 6 dots, and those 6 dots connect together during creation
To form the face.
And those combine the eyes, the nose, and everything, and one of those 2 dots actually creates the mouth. And those dots, for some odd reason, we don't know why, they don't get connected.
Deformed.
So then there is a disruption, there's interruption. So the circular muscle of the mouth gets interrupted and it doesn't complete the circle. And that makes it a cleft lip, which is also called hair lip. Hair lip, we see it from the hair, the hair have it, and they look like just like the cleft lip. So that's the hair is the same as a rabbit, and that's where the name comes from. But this
here we call it rabbit lip.
Rabbit lip.
In Sudan, we call it rabbit lip.
Rabbit lip. Yeah. So it's the same thing, right? So this can be partial. It can be incomplete. Somebody can just have just a small little angle on the lip going upwards. It could be further incomplete, or could be further way back into the mouth, called very complete. So depends on how those 2 dots come together and how much they got together.
طيب هو شرح لك شرح تفصيلي كيف تتكون هذه الشفة الأرنبية، وقال النتيجة للطفل في بطن أمه بيتكون الوجه من عدة أشياء وحددها ب6، وقال في منها 2 بيكونوا الفم، وقال لو حصل أي خلل بيصاب بهذه الشفة الأرنبية. طيب معنا اتصال ثاني. السلام عليكم. السلام عليكم.
وعليكم السلام.
مرحبا بك، اتفضلي.
يا دكتور سفيان، انا عندي ولد اختي اتولد بشفه ارنبيه.
طيب.
واتعملت له عمليتين والعمليتين ما نجحوا.
طيب.
الشفه ما رجع لطبيعته والنقره، وعنده حول برضه. وعنده حول. واتعملت له عمليتين، العمليتين ما رجع عن شكل الانف وشكل النقره للشكل الطبيعي.
وشكل الشفه رجع؟
لا ما رجع، ما بقى زي الطبيعه. نقرة لا ما طبيعية.
She's talking that her nephew, she's developing cleft lips, and he did 2 operations, and 2 operations failed. Even the shape of the nose and the shape of the lips are deformed.
Well, it is possible, and the possibility is that when you have a severe problem, if you have a cleft lip and a cleft palate, this cannot be repaired in one operation. There is a stage when the child is 6 months old, should have the first operation to repair the lip. But the palate is too underdeveloped to be repaired. So we
in this age.
Yes. So we like to wait 1 to 1.5 year to repair the palate. At that point, the child has grown enough, and we want to do this before the speech starts. So that's the second stage. Now, when you do the second stage, there is still a possibility that if the cleft was very wide, the nose can be very flat. But for the nose, you had to wait even longer. You had to wait till they are 12, 13, 14-year-old to get the nose taken care of. Although there are possibilities where we can correct the small deformities during these 2 operations, but the most of the deformity will be corrected when they are 13 or 14 years of age. Now remember, if somebody has a severe deformity, there is a possibility of several operations.
Not one operation.
One operation is not going to fix it. It's multiple operations, and they are done in proper stage. And again, the lip is done at age 6 and older. Although we have done cases like a month-old babies. The smallest we did is like 28 days old. But if that patient has cleft palate, that has to wait till they are year or year and a half old. So these are multi-stage operations, and the fail, when you say fail, it's a possibility that the wound separated. That means that this operation was probably not done properly. Most probably not done by an expert who has a good knowledge, a good training. Because if it's done with somebody who's properly trained, the word failure, if I think correctly, if it means the whole thing separated again, that means it was not properly operated on by a proper surgeon.
هو تحدث الأخت معانا تحدث عن الشفة الأرنبية ممكن في بعض الأحيان تحتاج لأكثر من عملية وأكثر من عمليتين. وقال لما الطفل يكون عمره 6 شهور في بعض الأحيان بتتعامل العملية الأولى للشفة، في عملية تانية للسة بتتعامل بعد 2 قال في عملية للأنف دي ما بتجرى إلا بعد الطفل يصل 12 13 أو حتى 14 سنة. فقال هي عملية عندها عدة خطوات. وقال العملية دي ما نجحت، السبب الرئيسي قال بيكون يعني عايزة لها زول يكون خبراته شوية كبيرة وتتعامل في خطوات مختلفة وفي الوصف بتاع السنين اللي هو قالوا ده بالترتيب ده، وكده العملية بتنجح. طيب معانا اتصال تاني. السلام عليكم. السلام عليكم.
وعليكم السلام.
السلام عليكم. تفضل
يا دكتور كفاء، انا احييك اخي.
مرحبا يا ابو رطل.
وحيي الدكاتره اللي معاك، الضيوف الاعزاء.
الله يسلمك، هم بحيوك ذاتهم يا ابو رطل.
انا شاهدت كم مره يا اخي طفل نجد عنده يعني شفه ارنبي. ونجد اصابعه كده ما مستقيمه، يعني ما عارف علاقه بالحكايه دي والله كيف.
بتلقى شنو؟
اصابع التحت بتاع ارجله.
اي ما في علاقه.
تلقى
ما يعني ولدوهم بكده، ولدوهم بكده
نفس اللي هناك كده تلقى
يعني ولدوه باصابعين وبشفه ارنبيه في وقت واحد.
في وقت واحد، وارجله ذاته زي ما تستقيم في الارجل، يعني ما عارف في علاقه والله ما.
This gentleman he is asking about one baby with a cleft lip and there is some deformation in his leg finger, in his foot finger. There is any relationship between
Yes, it's possible. There are definitely we call syndromes, which can be a combination of different conditions, where there can be a cleft lip and could be deformity in other parts of the body. So yes, that's possible.
It can be in the foot, it can be in any other organ.
Again, we don't know. We don't know the reason.
طيب هو يا برطل قال لك في بعض الأحيان ممكن يكون القصة دي لها علاقة، يعني يكون في التشوه ده في الشفة الأرنبية، وممكن يكون في الرجل، وممكن يكون في أي جزء تاني من الجسم. طيب نحن معانا اتصال تاني. السلام عليكم. السلام عليكم.
وعليكم السلام.
تفضلي.
هاي دكتور رجعت لك ثاني، عرفت قبل شوي قلت لك والدكتور يعني ممكن اقابل بيه الدكتور ده؟
طيب تجينا في الإذاعة الطبية ونحن إن شاء الله نعمل لك مواعيد مع بروفيسور مالك عشان يشوفوا. This lady she returned back to us and she want this baby to meet you. This is that baby who has done several operations without any success.
Definitely we will.
Okay. قال لك إن شاء الله تجي
In March we're here.
Yes.
We're here in March.
We come here every year.
Okay. إن
If
شاء
not
الله.
this year, next year. Again we're here.
Okay. She is asking about not this year. This is this week.
Okay.
قال لك تجي إن شاء الله. نمشي لمساحة إعلانية ونعود مرة ثانية لكي نواصل حديثنا مع الإخوة من الولايات المتحدة الأمريكية، الجمعية الطبية الإسلامية، وموضوع مخيم الشفا الأرنبية الذي بدأ بالأمس بمستشفى الأسنان بالخرطوم.
كلود، من هون رح يبدأ الجمال.
أنا عندي ليكم مفاجآت، أسرار طبيعية يا بنات، كلوا الطبيعي أكيد لبناني، وحوصي بيه كل الصحبات. عبد الشباب ده كان زمان، بشرة صبرا ده كان زمان، خليها بشرة نقية زي بشرة الأطفال.
مفاجأة كلود، صابونة كلود سكراب لتقشير وتنعيم البشرة بقشر الجوز الطبيعي وزيت الأرجان المغربي بعلامة الورد البنفسجي، خليها بشرة نقية.
للطلب والاستفسار يرجى الاتصال بالرقم 0922 088 088. المركز الرئيسي الخرطوم 2 غرب أوزون، وبكل الصيدليات وصيدلية بوتس الرياض وكل مراكز التجميل.
ألو يا دكتور، برعاية سوداني. تتمنى دوام الصحة والعافية لكل سوداني.
يا لطيف يا لطيف يا
ده شنو يا سليم؟ من البارح وانت لي هسي ما قمتي من السرير؟
جسمي كله بيوجعني، اي حته في جسمي دي بتوجعني، ما عارفه جاني شنو العايب.
لا 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 ما بخليك، قومي يا رح. انا حوديك للاخصائي.
اخصائي شنو؟ ما يمكن الجاني ده من تعب الولاده والعمليه الزمان، ولا يمكن كرعي ديل المعجله هنا الرطوبه. يا العاجبة يا أختي، ولا يمكن كمان يكون من ضرسي الحمان النوم طول الليل وهو ينتح وعيني يدمعن.
قومي قومي أوديك مركز خير النساء بمستشفى يستبشرون.
قلت لك الفيني كتير يشوفوا شنو ويخلوا شنو.
يا أختي هاي ديل بيهتموا بأدق التفاصيل من ساعة دخولك المستشفى، وعندهم جناح متكامل عشان مشاكل الولادة والعمليات. والعجب كمان عندهم غرف عمليات مهيئة ومجهزة بأحدث الأجهزة الطبية.
لكن عثمان قال عندي فحوصات كديدة إلا يسووها في الخارج.
كل الفحوصات اللي كانوا مسووها خارج السودان هسي عندهم. جابوا أحدث الأجهزة، حتى رسم المخ وتخطيط العضلات. قلت لك قومي يا رح.
هاي لكن نمشي هسي كده للوقت ده يعني ما
الوقت شنو؟ ده العيادات صباحية ومسائية، وكبار الأخصائيين والجراحين راجنك، حتى لأسنانك وعيونك البخور شو ديل. بتمشي ولا لا؟
كان كده بمشي.
قومي.
مركز خير النساء بمستشفى يستبشرون الطبية التشخيصي والعلاجي. أحدث صيدلية طبية للأدوية والمستلزمات الحديثة. العمل على مدار 24 ساعة. نرحب بالتعاقدات مع نوافذ شركات خدمات التأمين الصحي. موقعنا الرياض شرق المطار. مع تمنيات الصحة والعافية.
مع سوداني، التثقيف الصحي، الوقاية من الأمراض، الوعي والإدراك. مع سوداني أنت الكسبان.
ألو يا دكتور، برعاية سوداني. تتمنى دوام الصحة والعافية لكل سوداني.
أهلا ومرحبا بكم من جديد. نتواصل في مشوار اليوم وحديث اليوم والذي نتحدث فيه عن الجمعية الطبية السودانية والدعوة التي قامت بها للجمعية الطبية الإسلامية بالولايات المتحدة الأمريكية لإقامة مخيم عن الشفة الأرنبية بمستشفى الأسنان بالخرطوم. بدأ بالأمس ويتواصل طيلة هذا الأسبوع. سعيد أن يكون معي بروفيسور مالك، وبروفيسور مالك هو رئيس الاتحاد العالمي للجمعيات الطبية، وهو استشاري جراحة التجميل بجامعة ميسوري وبكاليفورنيا، وأيضا معنا مديرة العلاقات العامة جيسيكا، وأيضا في الاستوديو هناك طلاب في كلية الطب بأمريكا وهم جو مع هذا الفريق، ونحن هنشوف هم طلاب وجو مع هذا الفريق الدور اللي بيقوموا به شنو. ومعاي أنا اثنين، ندى سالم عن طارق. both of them الاثنين هم medical student. ندى, heartily welcome by you in Medical Radio.
Assalamualaikum. My name is Neda. I'm currently studying for medicine, and I'm on a mission with IMANA that I actually just heard about 2 weeks ago. It wasn't in the plan, and I was contacted and told to come and help translate.
Don't have to close.
I was told to come and help translate the Arabic for the doctors and to photograph and take videos. And obviously my responsibility went to a much higher degree. I've been helping the surgeons, and then we also have another medical student taught it.
اوكي. هي تحدثت عن انه هي حديثة العهد بالجمعية دي، لكن لما عرفتها طوالي شاركت معاون بتقدم الخدمات المختلفة للجراحين ولأفراد التيم المختلفين. اوكي. The doctor of the future طارق, we are heartily by all means of pleasure we are welcoming you in the Medical Radio.
Thank you. Assalamu alaikum. My name is Tariq. I am a final year medical student here on my second trip with IMANA for the SaveSmile mission. So far we're having a very great experience. It's good to help our Muslim brothers and sisters with their cleft lip. And it's just overall it's been a great experience being able to see the difference in people's life that it makes here.
Okay, what are the service which you are apply for this team?
Well, I applied to assist. I wanted, inshallah, I want to go into surgery. So I applied to assist and help in any way I possibly can. So far, the role that I've been playing is I've been helping Dr. Malik here in surgery. I've been scrubbing in with him and assisting in anything he needs. And it's been a great experience.
That means you select the line of the surgery?
Yes, inshallah. If I can.
Not anesthesia?
No, not anesthesia.
Why?
I'm more interested.
You like blood?
Huh?
You like blood?
I don't like blood. I do not like blood. Yeah, no preference.
Okay. Professor Malik, again we return back to you, and we want to tell us about post-operatively. What are the measures that can be done by the relative and by the co-patient post-operatively?
I think this is a very, very, very good question. All the parents, we try to train them. We try to give them all the instructions when the surgery is all done. Basically, you have to take care of the hygiene. One of the problems that we see is the mothers who are breastfeeding their children. They, against our advice, will go ahead and have them breastfeed. This can cause disruption.
Breastfeeding?
Yes. This can break the stitches because the baby is sucking.
And this is effort.
Yes, with the effort, the stitches can break. So we tell them not to do breastfeeding for at least a week, and I would say even 10 days. The best thing is the mother's milk is still the best milk. That should be pumped out, and that should be fed to the baby with a spoon or with a little cup. Yes. After 3 days of surgery, the baby can take a straw and can drink the milk with a straw if they're old enough. For the adult patients, we tell them to stay on the liquid diet for about a week, and after that start taking semi-solids, and then proceed to the solids slowly and gradually. Don't start eating steaks and things, right away. So these are the things that after each meal, if they can, they should wash their mouth with water, so that the food particles are not still sitting between
remaining
in the tissues and inside the mouth. And in small babies, we have to make sure that the babies are very curious. Anything happens to their mouth, they will take their hand and put it in the mouth. So what we do is we tell them to make sure they don't bend their elbows. We put like some kind of splint and straight, like a little board, and wrap it so that they cannot bend their elbow and reach their mouth. So these are the precautions if they can take. I think we can prevent a lot of problems and complications.
Infection
that can happen. And infection, of course, can happen. Alhamdulillah, it's a very rare complication. It doesn't happen that often. But if you don't take care of the wound properly, because we can't be there, after surgery, and it has to be a responsibility of the parents and the relatives to be very careful with the post-op care.
أنا تقدمت له بسؤال عن ما هي الخطوات التي يجب اتخاذها بعد العملية لكي نضمن نجاح العملية، فهو تحدث قال النظافة هي أهم حاجة، وقال برضو الأطفال الرضع يجب أنه الرضاعة تجي في أسبوع يكون ما في أي رضاعة، ممكن ياخدوا بالكوباية بأي حاجة، لكن الرضاعة ليه؟ لأنه قال العملية بتاعت الشفط ممكن تؤثر على الخياطة، وقال يجب أيضا نظافة الفم، وقال الأطفال المشاغبين أو الصغار إنه يحاولوا يدينهم ما يخلوها تجي على الفم. ليه؟ لأنه اليدين بتكون فيها وساخة، وهذه الأيدي الوسخانة ممكن يكون في تسمم جرثومي، وهذا التسمم الجرثومي يؤدي إلى العديد من المشاكل. وتحدث في النهاية عن نظافة الفم، وهو يقصد السواك، لأنه قال أجزاء هذا الطعام يمكن أن تؤثر كثيرا وتؤدي إلى أضرار للعملية. Okay, the doctor of future, Tariq, what are the benefits you gained from this camp?
The benefits I gained from this camp are many. For first, the experience I gain here, the knowledge I'm gaining, mainly the hands-on training, it's very hard to come by, especially with such professional doctors, so highly trained, and the ability to see so many patients of cleft lip and cleft palate in one place is a very rare thing for me. And so I really that is something I find very important. Other than that, it's very important to see that we're helping our brothers and sisters. It's emotional satisfaction that's also gained. And those are the main two that we're gaining from there.
Thank you. هو تحدث انه يعني استفاد اشياء كثيره جدا، واستفاد علاقات، واستفاد معرفه، واستفاد اشياء كثيره جدا جدا جدا. وندى what is your plan in future? What specialty you are going to take? Also surgery or?
Well, I actually want to be a dentist.
You are a dentist?
Well, I would like to be a dentist. I mean, in the future dentist, professional dentist. But coming into here, I didn't think I could do surgery because I thought I wouldn't be able to handle the blood and the cuts and stuff. But after one day of looking at all this stuff and seeing the difference, it's honestly worth it. It's nothing like all the blood that we see. It's nothing compared to the smile that we see after and the satisfaction that we see from the parents. So it's an awesome experience. And yeah, you never know. I might do dental surgery. I don't know yet.
Well, as a matter of fact, dental surgery is very important in the treatment of cleft lip and palate, especially in the palates. There is a lot of dental deformities. So involvement of a dental specialist, orthodontist, prosthodontist is very, very important. So all these children who have a very collapsed and closed palate, they need a very good dental care. So that's something that we should add to the
and clever
advice.
dentist.
Right, exactly. A smart one should be added to the care of the patients.
هو تحدث على انه طبعا ندى ماشيه في الاتجاه بتاع انه تطلع طبيبة اسنان، وتحدث انه بروفيسور مالك على ان طبيب الاسنان هو عنده دور كبير في الشفة الارنبية، لانه في كثير من الاحيان القصة بتكون متعلقة بالاسنان. جيسيكا، what is your advices to the patient now they finish their operation?
Once they finish?
Yeah.
I think it would be great if once they have surgery, you're talking about our patients. Yeah. Once they have surgery, if they can contact us and let us know how it's going, how it's changed their life. They can email us at hq@imana.org. They can, I don't know if they have email, but if they can share a story, they can contact us. We can give them the contact information. We would like to know how it's really made a difference in their lives. It would be great to get their stories.
Okay, what about Jessica call for those Muslims are having a plenty of money in the European banks?
Well, of course,
I call it Jessica call.
We definitely need donations and support to continue this mission. It's not possible without the support of our funders and our donors. We're extremely grateful for the funds that we get. We have a campaign called Even a Smile is Charity. You know, that's what the Prophet said, even a smile is charity. So we ask that they can donate. They can donate at imana.org. They can go to our website. There's a couple links on there. They can make a donation. They can make a donation specifically for Save a Smile. And again, we have missions all over the world. So we have missions in plenty of places, and they can see the other work that we're doing. But definitely, if we can gain support, we gratefully accept it and need it to continue this mission and this work.
إن شاء الله. هي بتتحدث على إنه يعني أنا سألتها إنه في مسلمين كتار عندهم أموال مكدسة في البنوك القرب، فهي قالت إنه تنادون إنه يشاركوا بهذه الأموال لمسح هذه الآلام لأخواننا المسلمين. I use, as I told you yesterday, to end my show by a Sudanese song. Today I select a special song for our greatest singer Osman Hussein. ليه تسيبنا؟ وليه تسيبنا? It means don't leave us. And why you are leaving us? Hussein Bazara, he wrote this song.
But we must. We don't want to. But we have to.
And he said, Hussein Bazara, the man who has wrote this song to his lover, why you leave me? Don't leave me. If you leave me, the pain will draw in my face. And not draw in my face, and it will remain forever in my face.
That sounds very
That is
nice.
why I request you. I love you. My emotional for you. I can give you whatever you like in this life. Don't be away from me.
We are always with you.
Thank you.
Even we are not here. Now, if you give us a Sudanese passport, then we are definitely here.
ثانك يو بروفيسور مالك. وتحدث انه قال نحن ما حنسيبكم وما حنخليكم ونحن معاكم هنا للابد. ليه تسيبنا يا حبيبنا؟ للضنا ما بينتهي وللشقل فوق جبيننا رسم خطوط ما بتمحي. مش حرام، مش حرام تحرمني حتى الابتسامة. مش حرام تحرمني حتى الابتسامة. تحرمني منك لو عتاب اشتاقوا وافرح بالملامة. If you blame me, I will be happy. Listen to this man.
Yes.
If you blame me, she's telling this to her lover. If you blame me, I will be happy. Blame me, but don't leave me. Professor Malik, what you can tell about this?
That sounds really nice.
Thank you.
Really nice.
شكرا لك Professor Malik. I would like to extend my great thanks to the FEMA and especially to Professor Malik and his group, and we hope to success everywhere you go. Thank you for all, and we hope to meet you in another time. شكرا لكل مستمعينا، شكرا لكل من تابعنا، وكان هذا هي حلقتنا الخاصة بزيارة الإخوة البريطانيين الإخوة الأمريكان إلى السودان لمخيم الشفا الأرنبية، وكم استمتعت بحديثكم وكم استمتعت أيضا بحديث الإخوة والأخوات متابعي هذا البرنامج، وإلى أن نلتقي في مشوار قادم. لكم مني أمنيات الصحة والعافية، وتحية الإسلام دائما هي الختام. السلام عليكم ورحمة الله وبركاته.
تسيبنا يا حبيبنا، ليه تسيبنا يا حبيبنا، للضلال ما بينتهي وللشقاء الفوق جبيننا رسم خطوط ما بتنمحي. ليه تسيبنا يا حبيبنا، ليه تسيبنا، ليه تسيبنا، ليه يا حبيبنا، ليه تسيبنا. كان حرام تحرمني حتى الابتسام، مش كان حرام حرام تحرمني حتى الابتسام. تحرمني منك لو عتاب اشتاق وافرح بالملام. تحرمني منك لو عتاب اشتاق وافرح بالملام. حرام اجيك بالشوق وعود بالهجر منك والخصام. ليه تسيبنا يا حبيبنا، ليه تسيبنا، ليه تسيبنا يا حبيبنا، ليه تسيبنا. أتعذب أتعذب براي، خليني أتعذب، خليني أتعذب أتعذب براي خليني أتعذب ضايع محطم في الهوى جفني المسهد بالدموع رويته ومرتوى اعتاد على طعم السهاد واعتاد على طول النوى ليه تسيبنا يا حبيبنا ليه تسيبنا يا حبيبنا ليه تسيبنا وريني لازم الزعل لازم الزعل وريني لازم الزعل لازم الزعل أنا قلبي قاسى واحتمل أنا قلبي قاسى واحتمل عللت بالآمال سنين عللت بالآمال سنين واصبح مقيد بالأمل لكنه يسألني الحنين كل يوم يا هالعمل
ألو يا دكتور، برعاية سوداني تتمنى دوام الصحة والعافية لكل سوداني.
99.3 FM صوت العافية. هنا الإذاعة الطبية 99.3 FM. بسم الله الرحمن الرحيم. إن الصلاة كانت على المؤمنين كتابا موقوتا. صدق الله العظيم. حان الآن موعد آذان المغرب. الله 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 الله